So I was asked to describe something about the role of psychiatrist on a vocationally oriented treatment team, and a couple of points come to mind, some of which you may have seen on the team meeting that we talked about earlier, that was recorded earlier. One component is obviously setting the clinical tone with the treatment team. In terms of the degree to which the team focuses on the competing needs of containment and control of symptoms versus helping people to move on from treatment and move towards a higher outcome. And so obviously the psychiatrist is looked at on the team as a leader who's going to help to set the clinical tone and to help make decisions about appropriate clinical interventions. And the psychiatrist, I think, can play a critical make or break role in terms of the team's willingness to take responsible risks at times to help a client move on rather than always leaning towards the side of safe containment. And so I think a critical role of psychiatrist is being willing to help the rest of the team feel safe in letting clients, assisting clients in taking risks such as trying a potentially stressful job situation, encouraging a client to move beyond the limits that they may place on themselves, and even potentially endorsing a vocational intervention as helpful to the management of their mental illness. And the area in which we see work as most helpful for people's management of their mental illness is in helping people to have an external focus for their thoughts, so that clients will commonly come back to us and say, when I'm at work, I'm less troubled by my voices, I don't hear them as much, or I don't attend to them as much because I'm paying attention to my work tasks, and my symptoms bother me more when I get home at night and I'm by myself. So it's a really nice contrast, and something we often use in clinical interventions to help clients recognize the potential value of vocational activity for management of their symptoms as a coping strategy. And of course, having a hopeful attitude and setting the goal of recovery as being what we're doing here. The treatment isn't just about suppressing symptoms. It's about helping people to regain their level of functioning and get to a point of recovery in their life. I think a recovery goal is a unifying goal that can bring the various members of a multidisciplinary team together towards the same direction with the client and other stakeholders like family members and such. In my years of doing vocationally oriented treatment, the other thing that I've learned is that the expansion of the treatment team into the community and the work setting gives me a lot more to work with as a clinician. That the feedback that I can get in terms of the effectiveness of the treatments that I'm attempting to use is much richer when I have information from the work site. The vocational specialist may be able to bring into the team meeting a completely different perspective from what I can get in an interview in the office on a person's behavioral response or symptom control, how they're functioning in settings where they need to be able to function. And ultimately, again, that's what treatment is about. We do cardiac rehabilitation to help people be able to function better. We should be doing psychiatric rehabilitation for the same reasons. And then that leads to the other direction, that both we have richer inputs when we're working with a vocational team, and then that it changes our outputs. Again, as we look at what we're trying to do, particularly with pharmacologic interventions. One of the things we talked about in the team meeting was an individual who seemed to be having a lot of impairment in both motivation for work and in his physical capacities. And we've been tapering his medications back to try and help with that, to increase his functional ability. Now, if my only focus were on symptom suppression, I might have kept his medications at a high level in order to suppress what had been a manic episode some time back. At the present moment, this individual has actually good stability there, and if anything is on the depressed side, and we've been trying to cut back on his medications a bit to to help with a profound sedation that he's been experiencing, and weight gain that he's been experiencing as well, that are limiting his physical capacities. And so there may be greater long-term gains from from being able to use the medication in service of his vocational goals and other recovery goals.